Welcome to CareLink SF, eClinical Works, EMR Training, Nursing Staff Visit. We'll begin the nursing visit workflow. This workflow example is not specific to any clinic. Clinic roles and workflow processes may differ from clinic to clinic. This is the office visit screen. This will be the default screen every time you log into ECW. Here, appointments are scheduled under Resources, so you will need to select a resource in order to view your schedule for the day. To select a resource, click on the ellipses button next to the Providers/Resources. The Select Providers window will open. In the drop-down menu next to View, select All Resources. Select a resource or resources by placing a check mark or check marks in the box or boxes next to the resource name. Click OK to close the window and view your schedule for the day. Refer to your clinic to determine what resource or resources you will be using to view your schedule for the day. Some nursing staff may have their own resource codes. Other nursing staff may use shared resources. If you would like to view all appointments at a specific health center or clinic, the best way to do this is to select Facility or Facility Group from the drop-down. Click Select and choose from the list of clinics within DPH. Place a check mark in the box next to All to view all appointments for the day at that specific site. For this scenario, I'll be viewing my schedule under Urge Care. Once you have selected your schedule, adjust the viewing preferences as needed. On the left-hand side of each note, you will see a padlock. The padlock will either be unlocked and open for charting, or locked, which means the note has been signed off on. Next, you will see the visit type, the appointment time and the patient's name, the appointment provider, the resource for the visit status of the appointment, arrival time, duration, and the patient's room number. The status column is used for communication purposes amongst staff to note where the patient is at all times during their visit. It may also be used to track cycle times. For example, the amount of time a patient was seen by a provider. The notes section may have a stethoscope to note that the patient's vitals were taken. You may also view all unlocked progress notes by checking the box next to Unlocked Encounters and selecting a date range. You'll be able to see which patients have been registered and checked in by the green ARR for arrived. You can also see which patients are ready to be seen from the status column. The status column will also tell you which patients are ready to be seen. Patients with the ELIG done are ready to be seen for a nursing visit. We can see here that our 8:15 appointment has arrived and is ready to be seen. Confirm that the appointment provider resource column is populated with the appropriate appointment provider. Labs and diagnostic imaging results, as well as prescription refills associated with this encounter, will return to whoever is listed as the appointment provider at the time of ordering. On your first day of clinic, verify with your clinic supervisor who should be listed as the appointment provider. Some appointments will have a provider's name listed as the appointment provider if labs or diagnostic imaging orders will be associated with that encounter. This is to ensure that all test results and prescription refills return to the appropriate appointment provider to review. Other appointments will have physician statistical as the appointment provider if no labs or diagnostic images will be associated with that encounter. For this scenario, this encounter will have associated labs or diagnostic imaging orders, so I will update the appointment provider from Physician Statistical to our test provider, Sam Willis, to ensure that requisitions have the correct ordering provider and results are relayed to the appropriate provider. To update the appointment provider, highlight the patient's name and click the caret next to View Progress Notes. Select Change Appointment Provider/Resource. Click on the ellipses button next to Provider 2. In the staff lookup window that opens, search the appropriate appointment provider, highlight their name, and click OK to select. To check in the patient for today's visit, highlight the patient's name and click Check In, Check Out from the bottom of the office visit screen. Place a check mark in the box next to Check In. Click the ellipses button to update the status from LH Done to Intake. In the field labeled Room Number, enter the room number. Click OK to exit the encounter window and save your changes. To view pending orders and instructions, place a check mark in the box to the left of the patient's name and click the View Orders button from the bottom of the screen. The patient's orders window will open. Click on the Future Pending Procedures tab to view any future RN clinic instructions that have been placed for the patient. If any future RN clinic instructions have been placed, the order must be transferred from the Future Pending Procedures tab to Current Procedures tab. To do so, select the procedure and click Transfer to Today's Visit. Highlight the procedure and click View from the Current Procedures tab to open the Procedures window. Review the Notes section at the bottom right-hand side of the window. Provider instructions will be listed here. After the order has been completed, check the box next to Received under Results and change the procedure status from Open to Reviewed. Click OK to exit the Procedures window and save your changes. To open the progress note for scheduled patients, double-click anywhere on the appointment row. To document vitals, if necessary, click Vitals from the Objectives section of the progress note. The yellow row indicates the current encounter for which the progress note is open. This indication is useful when the patient has more than one encounter for the same date. Prior to entering vitals, confirm that there is a check mark next to the pop-up. This enables the pop-up window, allowing you to proceed through separate windows for each field. Click on the yellow highlighted empty field below BP to begin entering vitals. The vitals pop-up window for entering the patient's blood pressure will display. Enter the BP or click the numbers in the number keypad. Use the qualifier drop-down menu to indicate if the BP was taken standing, sitting, or etc. To move the BP entry to the right pane, click the arrow button to the right of the qualifier. Click Next at the bottom of the window to move to the next vitals pop-up window. Enter other vitals as indicated per clinic protocol. Note that height will carry forward from previous visits and does not need to be re-entered at each visit. Click Apply to close the Vitals pop-up window and display all entered vitals in the main Vitals window. Check the box next to Vitals Taken at the bottom of the main Vitals window when completed. Click the X to close the Vitals window and save changes. Next, merge and complete the templates appropriate for the RN visit type. Refer to your clinic workflow for specific RN visit templates. Click on the Templates tab from the right chart panel. If the appropriate template that you need does not display in the right chart panel, you can add it by clicking Templates from the bottom of the screen and typing the name of the template you are looking for. Highlight the template and click Add as Favorites. Close this box and the template will be available to you from your right chart panel. To merge a template, click the arrow button next to the template name. I will proceed by merging the SA-FHC blood pressure template. Notice how the template populates the HPI section with the category Hypertension. Click on the BP evaluation to document and select values as indicated. To document general nursing assessment notes, click HPI and select Nursing Assessment. In the Notes section at the bottom of the window, free type any general nursing assessment notes or observations. Close out, and your notes will populate the progress note under the template. Click on Assessments to add a diagnosis or assessment code. When you first go to the assessment window, make sure that you're in the Smart Search and not the Classic Search. When adding assessments, make sure that you are adding ICD-10 codes to your note. ICD-10 codes generally begin with a letter, while ICD-9s generally begin with a number. Ensure that the Use ICD-10 is selected, type the assessment or diagnosis, and click Go. From the results, choose the appropriate diagnosis. If the ICD-10 code is blue, it will serve as a link to a more specific diagnosis. Click on this link to increase specificity. Continue adding assessments. Click on the diagnosis if you would like to add it as is. You can choose from this patient's previous assessments or from their problem list. When you do this, make sure that the auto map to ICD-10 is selected, because some of the previous assessments may have been added before the ICD-10 transition. Also note that if you bring previous assessments in this way, they may have notes attached to them from previous visits. Check the Notes section here to see if there are any notes attached to this assessment. Select the primary diagnosis for the visit. Select PL to add the assessment to the patient's problem list. To remove an assessment, click on it and click Remove. You may also add assessments to your note from the problem list in the right chart panel. Make sure that the problem list has been updated to ICD-10 codes if you do this. Click on the arrow next to the diagnosis you would like to add. These assessments may also bring in notes from the previous encounter. Now that you have added assessments, you can order labs, diagnostic imaging tests, immunizations, and therapeutic injections as appropriate according to your clinic standard ordered protocol. You may place your orders in the treatment link or by using an order set from the right chart panel. Click on Treatment. This is your one-stop shop for all orders. Notice that each assessment you have added has its own tab for orders. Before placing any orders, update the appointment provider to the correct provider on the progress note to ensure requisitions have the correct ordering provider and results are relayed to the appropriate provider. To do this, select the caret next to Details and change the appointment provider/resource. Ordering tests. When placing orders, it is important to link the order to an assessment. To order labs, click Browse. Assessments that you have added will be on the left. Select the assessment that you are ordering the lab for, and then search the lab to be ordered. To continue ordering for other assessments, change your assessments from the left-hand side Certain labs and diagnostic imaging will require Ask on Order questions that will appear when you click OK. These questions must be answered in order to carry out the order. Your orders will appear under the corresponding assessment tab. To order diagnostic imaging, click Browse. Diagnostic imaging will always appear under today's orders. Choose your assessment that you're ordering for and search the diagnostic image. To assist in ordering, you have the option to use order sets. Order sets are a group of treatment options, including prescriptions, labs, diagnostic images, and procedures. They can be specific to a diagnosis or a clinic. Your favorite order sets will be saved and available in your right chart panel. You can access a link to all order sets available in DPH by clicking on the red OS. The drop-down will provide you with a complete list of order sets. When you have found an order set that you would like to save, click on the yellow star to add to your favorites. This way, the order set will be available to you in your right chart panel at all times. To order from an order set, select the gray OS next to the order set you would like to use. Select the order that you would like to place and click Order from the top of the screen. To print patient education from the treatment window, click on Education. You can print patient education or prescription education. This will take you to the HealthWise website. Based on your assessment codes, you will see Suggested Education on the left. Education with a global icon is available in multiple languages. You may print the documents if necessary. You may also search for additional patient education using the New Search tab. Next is Immunizations and Therapeutic Injections. Click on either of these links. To add an immunization, click Add. Type the immunization. And document the dose and the lot number by clicking on the ellipses. Confirm that the lot number for the immunization matches the lot number on the immunization label. Select the immunization and click OK. Document the location, the route, and given by, which will populate to yourself. Click OK when finished. To order therapeutic injections, click the Add button next to Therapeutic Injections. Type the therapeutic injection. And document the dose, lot number, location, route, and given by. Click OK when finished. Close out of this window, and Immunizations and Therapeutic Injections will appear in your note. Visit code. This window will provide you with a summary of all the assessment codes used in the visit. Here, you can add or remove codes. Make sure that you have a primary diagnosis selected for the visit. Click Add E&M to add the E&M code. We'll add 99499, which is a no-charge RN visit, and click OK. This completes charting in the progress note. You'll need to return to the office visit screen to complete the clinical checkout for the patient. To do so, you can click on the S jelly bean, select the patient, and click Check In, Check Out from the bottom of the screen, and select Check Out. To check the patient out from the resource schedule, click on the resource schedule from the left chart panel. Double-click on the patient's name and change the visit status to Checked Out. Lock the progress note once all documentation is complete by selecting the caret next to Lock and selecting Lock Modern 3. All notes must be locked within 72 hours of the visit. Here's a preview of a locked progress note. If needed, assign the progress note to a provider as an FYI. To assign your progress note, click on the caret next to Details and select Change Assigned To, and enter the appropriate appointment provider's name in the To field. You may add any additional notes in the Notes section. Thank you for watching ECW's Nursing Visit Workflow training video. For questions or suggestions, email us at carelinksftraining@sfdph.org.